Hi, I'm Danielle Vonfelt with Hayes Medical Center in Hayes, Kansas. We are going to go over some things you should know after your surgery. It is common to have some pain or discomfort after surgery. It may last a few days to a few weeks as your body heals. It is important to take your prescribed pain medication as directed. Remembering that pain medication can take 30 to 45 minutes to start working. If you will be doing physical activity, plan ahead and take your pain medication approximately an hour before activity. Do not wait until your pain is severe before taking pain medication. However, if your pain is severe after taking pain medication as prescribed, you should contact your surgeon's office or go to the emergency department if after office hours. You may also call a Hayes Med 1 call 855-429-7633 if you have questions or concerns. After surgery, follow your surgeon's instructions regarding activity and start slowly, increasing as tolerated. If increasing activity too fast, it may cause more pain and discomfort as well as dizziness. Nausea and vomiting are common after anesthesia. You may be sick to your stomach for 24 to 48 hours. If you are nauseated, it is important to stay on clear liquid diet for 24 hours after surgery and then advance as tolerated. If not sick to your stomach, then you may keep advancing your diet back to normal. Avoiding greasy and spicy food is advised. If nausea and vomiting persist past the time period, notify your physician's office. Reminder, pain medication and antibiotics can cause nausea, vomiting, especially if not taken with food. After surgery, you may notice some bleeding at your surgery site. It is normal to have light drainage through the dressing. The more activity and movement, the more your incisions may bleed. If there is a large amount of bright red bleeding and your bandage is saturated, leave the original bandage in place and place another bandage on top of it. Elevate, apply pressure, and notify your surgeon as soon as possible. It is normal to have a low-grade temperature up to a week following your procedure. This is a normal stressor response to having a surgical procedure. It is also normal to have a small amount of swelling and redness at the surgical site. If you notice the swelling and redness is increasing, notify your surgeon. To decrease the chance of infection, keep your surgical site clean and dry. If your surgeon orders an antibiotic, take it as prescribed and finish the full prescription. Signs and symptoms of infection include, but are not limited to, fever greater than 101.4 degrees Fahrenheit, increased redness, warmth to the surgical site, green, brown, milky drainage from the surgical site, foul smell from the surgical site. If you received general anesthesia during your procedure, you will go directly to the recovery room for a minimum of 30 minutes after your procedure. Once you have started to wake up from anesthesia and your vital signs are stable, you will go back to ambulatory surgery where you will stay for a minimum of 1 hour. After returning to ambulatory surgery, you will be reunited with your family. When you are awake and alert enough to drink or eat, we will allow you to do so. You will be started on clear liquids such as water, juice, coffee, tea, jello, or popsicles to ensure nausea is not present. If it is not, you may have crackers, toast, applesauce, or pudding. While in the recovery phase, your oxygen level will be monitored at all times. Your blood pressure will be taken every 15 minutes. For these reasons, you'll be hooked up to the monitor for the majority of the 1 hour after your procedure. There are exceptions if you are up to the restroom or walking in the hallways. If you received general anesthesia care, there are certain requirements that you must meet before you are discharged. They include tolerating clear liquids without nausea, controlled pain, and voiding. If you received monitored anesthesia care or IV sedation, it is not required for you to empty your bladder before being allowed to be discharged. When you have met discharge criteria as listed above, your nurse will remove your IV and go over your discharge instructions. Written instructions will also be given to you that will include the side effects of anesthesia to monitor for. Your family member or friend may choose to bring the vehicle to the entrance at this time. You will be given the opportunity to walk to the vehicle if you feel up to it. Otherwise, a wheelchair will be available and offered to you for your safety. After you are discharged, notify your surgeon or go to the local emergency department if you experience chest pain, shortness of breath, notice any signs and symptoms of infection, excessive pain, increasing drainage from your surgical site, experience numbness, tingling, or cold fingers or toes, have persistent nausea or vomiting, or fever lasting over 1 week, or temperature higher than 101.4 degrees Fahrenheit. If you have any questions or concerns, please call 855-429-7633, which is the Hayes Med 1 call.